Hello and welcome to Three Counselors and a Client. Today we're going to be working from three different techniques or theories, and we're going to introduce ourselves right now. Thank you for being here.
Hi, I'm Dr. Andy Brown. I am residency lead and a professor here at the Chicago School. I'm going to be doing eye movement desensitization and reprocessing, or EMDR, which is considered a power therapy primarily used in the treatment of trauma, but also used in a variety of other facets or with other diagnoses like anxiety, phobias, and these kinds of things.
I'm Dr. VanMeter. I'm a professor here at the Chicago School as well, and I will be working from a relational cultural theory framework, which the tenets of that is basically relational experiences, authenticity, resilience, and empowerment from a cultural perspective.
And I am Dr. Rodney Harris. I'm also a professor here at the Chicago School, and I'm also the director of the Virtual Clinical Training Center. And I am going to use a brain spotting technique called the outside window, primarily used for the treatment of trauma and anxiety, and I'm excited to work with it today.
And I am Dr. Michelle Colarusso, and I will be the client throughout all three different theories, and I will be working from the same presenting problem across all three theories.
All right, we're going to begin.
Okay, Michelle, I'd like to thank you again for allowing us this opportunity. You're amazing, so thank you.
Thank you for being here.
I want to step back through. You shared some things with me earlier, and I just want to make sure these are still true of you today. We talked about your grandmother, and you had some struggles with your grandmother, particularly as it relates to technology. And one of the things, the situation that kind of came up for you is that when she has a need, it's really pressing, and she really kind of gets in your face about it. The target, which is like the picture that really comes to mind that bothers you the most when this happens, is her, needing help with her phone. Like technology, she's like, Michelle, come here, help me with this. And you were just like, it really seemed to bother you. Could you bring that image up in your head as we're sitting here and just let me know when you have it?
It's here.
Okay, so when you do a body scan from your head down to your feet, where do you feel any tightness or tingling or any sensations today?
Neck and upper chest.
Neck and chest. Okay, very good. Thank you. And what emotion aligns with that image that you have, with that target image of your grandmother asking or really kind of forcefully asking for help with technology or the phone?
A lot of stress and anxiety and frustration.
Okay. All right. Added stress. Very good. Thank you. On a 0 to 10 scale, or SUD scale, subjective unit of discomfort scale, 0, no feeling whatsoever at all, and 10 is like completely wigged out, like a full-blown anxiety or panic attack or whatnot. Where would you put yourself at today?
A 3.5.
Okay, thank you. All right, so now, as we talked about the technique with this, Michelle has headphones on, and she actually has some bilateral stimulation music that we're going to be using for this protocol. This is modified for telebehavioral. And so we're going to have, Michelle, I want you to kind of go back into that memory node of your grandmother, that target of her, forcefully needing help with the phone. Notice where you're feeling it. And I'd like for you to go ahead and hit the on switch for the bilaterals. As the bilaterals go, I'd like for you to shift your eyes whichever way the music is shifting in your ears. Do you hear the music now?
Mm-hmm.
Is it shifting?
Not yet.
Okay, very good. Does it shift in between both ears? Okay, good. Okay, if you'll pause the music for just a moment. Okay, I'd like for you to blank out your mind right now, almost like a whiteboard that, board that we kind of erase out. Take a deep breath and tell me the first thing that comes up for you.
Rest.
Okay, very good. All right, I want you to hold on to that image of rest with that image of your grandmother, and I'd like for you to continue to go. So if you will start the bilaterals again. Okay, and if you will stop them for just a moment and take a deep breath. Okay, just blank that out. And what are you getting now? What comes up for you now?
Stress.
Okay, very good. All right, I want you to hold on to that stress and the image of your grandmother. And let's continue. So if you'll start the bilaterals again. All right, if you'll pause that and just take a deep breath and just clear your mind for a moment and tell me the first thing that you have coming up.
Anxious.
Okay, very good. All right, hang on to that and hang on to the image of your grandmother. Notice where you're feeling it in your body. And let's continue with the bilaterals. Okay, so let's stop there for a minute. Again, thank you. You're doing wonderful. All right, if you'll just take a deep breath, very good. Nice cleansing breath. And just clear your mind and tell me the first thing that comes up for you now.
Rest.
Rest. Okay, very good. I want you to hold on to that. Hold on to that rest. Notice where you're feeling that in your body. And let's continue with the bilaterals. Okay, if you'll pause them for a moment and again, take a deep breath. Just relax your body. You're doing great. And what's the first thing that comes up for you now, Michelle?
Relief.
Relief. All right. That is wonderful. Hold on to that. Hold on and notice where you're feeling the relief in your body. And let's continue with the bilateral stimulation. Okay, Michelle, if you'll stop the bilaterals for a moment and again, take a deep breath, clear the mind, and tell me the first thing that kind of comes up for you.
Relief again.
Relief. Very good. Michelle, if you won't mind going back. Now, if you were to kind of rate your overall discomfort on a 0 to 10 scale, where would you put yourself now?
About a 2.5.
Okay, very good. All right. So, today we're just doing like a snippet of the EMDR. You did a beautiful job. Even within a less than a 10-minute period, you're able to bring down your score by a full point, and we're certainly heading in a good direction. And our premise, of course, is getting out the triggers and the things that are really festering inside of you emotionally that cause a lot and drive a lot of the pain and whatnot. So I'm going to step aside now for a moment so Dr. VanMeter can step in and do her bit, but I wanted to thank you again for this opportunity. I appreciate you.
Thank you.
Hi, Michelle. Thank you so much
Hello.
for being here today.
Hello.
Hi. So what brings you in today?
So I'm having a lot of stress and worry surrounding my grandma has a really hard time. So she's 86 years old and she's very impatient and she doesn't have patience for many things. And so I don't consider myself someone that has a lot of worry and anxiety, but she just creates this anxiety that I know that it's from these situations with her because she doesn't have patience and she needs something every minute of the day and most of it's unrealistic. And it's just like never ending until she gets something that she needs. And so that kind of frustration is why I'm here today.
Yeah. Well, I mean, it sounds like you have a good relationship with your grandmother, but
Yeah.
it also sounds like you feel almost a burden to help her, but at the same time, you want to make peace in your relationship and be able to have a positive relationship with her.
Right. Yes.
Mm-hmm. Tell me more about what you think is getting in the way of that positive relationship with her.
I think it's a lot of around like just frustration of kind of sometimes I fluctuate between the idea that she can do more things, but then also, I give her the benefit of the doubt. She is 86. She lives alone. And you think of like, most people have this picture in their head of like their grandma with like little white hair and a walker. And, that's not her. She drives, she goes to the casino, she goes and exercises. And, so she's 86, but she doesn't feel like she's 86. So I think part of that gives me, I try to give her the benefit of the doubt of she is my grandma and she's old and she doesn't have the, patience as well as she might have before. But then it's kind of like, she needs to have it.
Mm-hmm. Especially with technology.
Exactly.
Mm-hmm. So you brought up her patience level. What about yours? Has that changed?
I think it has because of just having, my grandma has 4 kids And there are 16 cousins, and we're all older now. So we all pretty much still live around here. So we're all able to help her. And two of my cousins are actually her next door neighbors. Her son lives next door to her. So she has support, but she seems to only reach out to certain people. And I seem to be one of those certain people. So I think the more that I think about it, sometimes I feel like my frustration doesn't necessarily lie with her, but the frustration is more of no one else is there to kind of help or assist her in any way.
Mm-hmm. So her anxiety makes you feel responsible for her anxiety.
Yes.
And then need to respond to her.
Yes.
Mm-hmm. I mean, it sounds to me too like part of your relationship is your grandma's boundaries for your well-being and your wellness is limited.
She doesn't have, she doesn't, and this sounds really terrible to say, but like she really doesn't think of anyone else like but herself. Like, and it's not like in a selfish way. And I probably sound like a horrible person for saying that, but it's like she needs what she wants when she wants it. And if she doesn't get it, someone's going to hear about it. And it's funny because my mom and my sister and I, and even my aunt, like we'll be together doing something and my mom's phone will ring and my mom misses it or doesn't answer. And then like you can just go see her going down the chain of like, who can she call to get what she needs? So it's not so much like that I feel like it's on me, but it's just that like pressure that if someone doesn't help her or she doesn't get what she needs within that minute, it's just gonna blow up, essentially.
Trickle down. So what happens you're saying that she will continue to call other people, but she calls you the most. She leans on you the most, even though she has a big support system. So what happens if you don't answer the phone?
She'll end up that sometimes she'll text me and then she'll say, call me when you get a minute, or call me whenever you can, or sometimes she'll call my sister or call my mom and say, where's Michelle? Where is she? Or she'll go to somebody else and ask them the exact same question. And sometimes it's even if I do respond, she's still going down like her phone tree of people that she's reaching out to for, sometimes it's the simplest need or the simplest decision.
Mm-hmm. Well, it sounds like too, if you don't respond, there may be a sense of guilt hidden underneath that.
I think there is. I think I do feel a sense of guilt around, again, like she is 86. She can't do all of this stuff. So there is that sense of like, I give her the benefit of the doubt, but sometimes it's just like, too much is too much. Like she gets herself into these situations that, it's kind of like we see the outcome of not being the best decision. And she might go through that call tree and everyone might tell her that it's a bad decision, but she might get to that one person that says it's a great decision. And because she wants to do whatever this thing is, she hangs on to, well, so-and-so said that this was a great decision, so why don't you think and it's just like this never ending conversation. So it's like, I know that even if I give her an answer, and even though I know I give her a response, it's almost not going to end that situation. So you're right. It's probably this like constant feeling of guilt or just stress that no matter what I say, it's not going to end. It's not going to resolve her situation or whatever the example would be.
It sounds like, from what you're saying, those feelings of responsibility, somewhat burdened, some guilt, like maybe one of your goals in this relationship is to set clear boundaries, but still be able to maintain mutual empathy.
Yeah. And I would love to do that because I don't want to, feel like I'm not empathetic or I'm not compassionate towards her, or kind of, how you get to that point where it's like, you only can take so much, so you like don't care anymore. I don't want to get to that point. But it's hard to feel like you're being at all helpful whenever it's like no matter what the answer is, it doesn't matter sometimes, or it doesn't, there's always going to be someone else that gives a different answer or the same answer, or, you know, she's looking for what she wants in her mind. And if I don't tell her what I think she wants to hear, it's going to just continue to go on. But if I agree with her, it ends. Or if I agree with her, she's like, oh, you're right, I feel so much better, thank you for talking to me. And it's over with. But usually I don't agree with her because her decisions aren't that great.
So it's like like you're constantly battling yourself.
Exactly. Yes, I'm constantly battling myself. I know what I can do to get away from it, but I try too hard to make her see that her decisions are bad decisions or whatever she's doing.
Well, and that sounds exhausting for you, because it seems like you're really trying to maintain this connection with your grandma, and it sounds like she really wants it, but it also sounds like, again, that mutual empathy piece needs to be there. So you're giving a lot, but, you know, I'm wondering how you might address your needs in that relationship.
I think that's the challenge, because I don't think that she even gets that. And I see that a lot with her in even other relationships. Like, she kind of only wants to address what she needs. And so I see that she doesn't, not that she doesn't have that empathy, but it's kind of like her world revolves around her. And that's kind of what she feels like she needs. And it's not that she doesn't care, but she cares more about like what she needs to do, or how people see her, or what her part is in the scenario, instead of kind of like what other people think. So I don't feel like I would ever be able to get that from her. So I don't think that's like, I hear what you're saying, but I don't feel like that's like an expectation that she would ever be able to meet, or that she even realizes that she's not meeting. If that makes sense.
Yeah, that makes sense. So in your other relationships, what do those look like?
I feel like I definitely have more control, or more kind of like maybe heard like other people, or like, for example, like my other immediate family, like we're able to have like a conversation around, you know, why is this good? Why is this not good? What's going on? And we're all able to kind of take our side, but also be able to hear the other person's piece, I guess. But for my grandma, he doesn't hear that. And she just doesn't, I think that's the part that's the most frustrating, is that you can't have that rational conversation, because there's no rationalization. It's, you know, her way or no way.
Yeah. Well, Michelle, thank you so much for coming in today. I can tell that there's a pattern and a theme here of the frustration and the need to be responsible and to help your grandma, and that mutual empathy piece of wanting to acknowledge that you understand her limitations, but you also understand her strengths, and then being able to set those boundaries with her in an ideal relationship, right? But acknowledging that that may not occur. So next time we meet, I would love to dive in a little bit further into, I mean, what you think it might look like to set a boundary with your grandma, or what it might look like to support her in a different way.
Yeah, that would be really good. Thank you.
Thank you. I appreciate you. Next, you're going to be speaking to Dr. Harris, and he's going to be doing brain spotting with you.
Good afternoon.
Hello, how are you?
Hello. I'm doing well, doing well. Let me just adjust my lighting a little bit. So, what brings you in today?
A lot of stress and kind of frustration around the demanding relationship that I have with my grandma.
Okay, understand that. So I want to ask you a quick question. So let me ask you, as I ask you that, how, and I noticed when I ask you that, how activated, and I know you've heard that word before, I heard it a little bit earlier, how activated are you on a scale of 1 to 10? What number would you give that?
I would say a 5.
Okay. And if I asked you where you felt that in your body, where would you say you felt it?
Probably like my chest and my stomach.
Okay, your chest and your stomach. Okay. I am going to introduce something to you, and I might have to turn on my light.
Okay.
But can you see this? Can you see this pointer?
Yes.
Yeah. Okay. I want you to look right here at this, and I am going to scan. Make sure you can see a little bit good. It might help you a little bit. So I'm going to scan from right to left horizontally, and I'm going to just kind of pay attention to blink stares. I'm just looking for just what I notice in your body. So just for a second, can you just pay attention? If I go off screen, just let me know out of your field of vision, okay?
Mm-hmm.
Here we go. Come back this. Okay. I think I know. Okay. Okay. I think I'm going to come right about. Let's see. Okay. Let me see. Right in. Okay. Right about here is where I'm going to park. Yep. Right about there. And what I would love for you to do is to focus on this spot. And as you think about what we just processed, focus on the pointer, focus on the spot, and tell me, well, let your brain just go and see what comes up for you. As you think about it, as you reflect, just let your mind, just let your brain, just let your body, just for a couple of minutes, just see whatever comes up for you. Just relax and breathe and see what comes up for you naturally.
I feel a lot more relaxed than I did whenever we first started. I think that focusing on one's point helped. I found myself getting a little distracted by other sounds at some point, but I feel for the majority, I was able to focus on that one spot as you moved forward or back and forth.
Just notice that and sit with it. So Michelle, I just wanted to take a moment and introduce this to you. And I noticed you said that as you were listening to the sounds and you found yourself being more relaxed, that the power of brain spotting, the power of this technique is allowing you to do and allowing the brain to process as it needed to do, and allowing you to do what you needed to do. So we'll continue in the future to do some deeper levels of this work and to bring you to deeper levels of the awareness. I appreciate you coming here today and looking forward to experiment and do some more, introduce you to some more of the techniques.
Thank you very much. Thank you.
Bye-bye.
All right. Well, Michelle should be completely resolved of like every issue she's ever had at this point with 30 minutes of this. Dr. VanMeter, would you like to begin our processing?
Sure. So what was that like for you, Michelle?
I think it was interesting because I started off really anxious. And then whenever I met with Dr. Brown and I did EMDR, I felt less stressed. And then whenever I was started talking about it more with Dr. VanMeter, I felt that anxiety kind of come back, and not in a bad way, but in a way that it was almost like I needed to talk about this frustration. And then whenever I did brain spotting with Dr. Harris, I felt that anxiety still there at the beginning. And then I felt a sense of guilt a little bit around kind of getting that distraction. I felt like I could have done a better job and not have been as distracted, or felt that distraction kind of pull away. But I also felt like I was able to bring myself back and felt less stress at the end overall. So it was kind of a good mix of feelings.
Mm-hmm.
Sounds like a roller coaster.
It was. It did feel like a roller coaster.
Well,
It
good.
was cured after 30 minutes.
We had a mixture here between what we consider like power therapies and traditional therapy Dr. VanMeter did or whatnot. And I know, and knowing Dr. Harris and speaking with Dr. VanMeter as well, I've never talked to her about this before, but most of us feel that one size does not fit all. And typically, when I have clients come in, I'm really kind of assessing them for the theory or the technique within the theory that I might use with them. Certainly you're what we would consider, for the most part, an ideal client.
Mm-hmm.
Highly intellectual, highly verbal, one of those that's like, I don't know how motivated you are, to change, honestly, but, by and large, you fall in that category that, wow, I wish I had a whole lot of Michelles that I saw. We didn't account for things like resistance and these kinds of things. One of the differences between the theories we're using, Dr. Harris and I use something that's more from the bottom up, which is the older part of the brain. We're looking for things in the amygdala and the limbic system and stuff like that, triggers, which is where they reside. And we're looking at bringing those things up and encouraging the brain to kind of heal itself. Dr. VanMeter is working from the cortex or the top down. So the cortex, she's getting inside of your thought processes as it relates to your problem and whatnot. So that's one of the biggest issues with or differences, the contrast between the theories that we're using with regards to how they work within the brain.
Mm-hmm.
I can see that from a client perspective, because I think it's really interesting with Dr. Brown and Dr. Harris. I didn't feel as much pressure to have to kind of think about what I feel. It was almost like this natural progression of take your time and think about what you feel. What was the first thing that came to your mind? And so there was less pressure and more freedom to kind of just like free associate with what I was feeling and share that. Whereas with Dr. VanMeter, although she used very many open-ended questions and very inviting, I felt more like I had to kind of explain what I was feeling, and not in a bad way, but I can definitely from a client perspective see the differences of what you just mentioned.
Mm-hmm. Well, and exactly what you're saying, part of relational cultural theory in general is that neuroplasticity. It's the idea that the brain is never stagnant and is constantly in change. And so when we bring up conversations that bring on anxiety, then we're also looking at how is that changing the way you want to relate to someone, because it's about relationship and experiencing that. And so, yeah, with relational cultural theory, and then watching Dr. Harris and Dr. Brown use very somatic and calming techniques too, to get you in this space of understanding what your body is feeling and where you're going to, like, how you're going to regulate that was really important.
Yeah, and I know that oftentimes clinicians and even clients will struggle with watching this technique and even feeling it because, that in brain spotting, that the brain will do exactly what it needs to do. That's what we trust, that whatever direction or whatever the brain needs to do. And so there's this tendency to, want to say something or do something, and that we notice that, your eyes are doing the processing. And I know when I first started brain spotting, I would want to say, oh, say something, I will feel this need to do something. And, naturally, as I'm watching your eyes, the beauty of it is I'm knowing that your eyes and the brain, are processing, and that your brain is taking care of itself, and whatever that you need to do, that the brain is healing itself, as you are thinking. And that's where I knew your brain told me like I was at the spot, because like when I got there, you said, mm-hmm. And like, as I was searching and you confirmed it for me, you were like, that's where I need. Your brain told me like, amen, you're right. You're at the right spot. So as I was like trying to make adjustments, you confirmed it for me. You and your brain confirmed it for me, spoke to me and said, this is the spot.
Right. Well, I know that we could wax on about this like all day, but students probably have to get back to their residency classes and whatever they were doing. And certainly they may want to debrief this for themselves. A couple of things. What we're keenly aware of with meta-analysis is that what we're seeing over a long period of time is good therapists do good therapy, regardless of the theories that they use. And while there's some theories that are specifically for issues like trauma, these kinds of things, it really comes down to the clinician and their efficacy. And also over 95% of therapists over a period of time become integrated. And so a lot of people think, I gotta get a theory, like they've got to marry to a theory or something like that. And the truth of the matter is a lot of us, majority, and I would say probably the 5%, are not fully aware that the fact that they're probably doing integrative work, but I'm not going to throw anybody under the bus. It's fine if you're a purist, but a majority of people will go into integrative over a period of time. So would anybody like to add anything before we sign off?
I think, Dr. Brown, what you said, it's all about the relationship. That's key to what we're all doing.
Absolutely. Thank you again, Michelle. You were like amazing, and we appreciate you're going through this roller coaster of emotions with us today.
Yes, thank you, Michelle.
Thank you all.